So let's talk about scope of practice. There are some jobs out there that have very little overlap. For example, a pharmacist may give a vaccine, a nurse may give a vaccine, but most of their job is going to look very different. Nursing is unique because you're going to work on a team with a lot of other people, this nursing team, and everyone's going to have a lot of overlap in their scope of practice. So it's the nurse's job to figure out how we can leverage the strengths and the scope of practice of other people on the team to make sure we're efficiently taking care of our patients. Let's talk about the 5 rights of delegation. First, we have right task. You have to make sure that the thing you're delegating is appropriate for the person you're giving it to. First off, it needs to be within their scope of practice. Usually it's a routine task with minimal risk, and it has a predictable outcome. The nurse is the one who's using the critical thinking here and making decisions about what has minimal or more risk. Next up, we have right circumstances. It should be a stable client, and they should have adequate resources and supervision to do that job. Next up, we have right person. That person should have competence in the task that we're delegating prior to us delegating it. And then also knowing that they have the appropriate knowledge, skills, and abilities to do that task. A lot of times it's going to be the RN delegating to an LPN and a UAP, or the LPN delegating to a UAP, or an RN delegating to other RNs. Next up, we have the right direction and communication. We need to be giving clear instructions, including the time frame. You can't just say, hey, go grab me some vital signs. Say I need it within 10 minutes. We also need to communicate the specific needs of the client. If you ask someone to go help feed a client and they're on thickened liquids, that's something you have to communicate. Make sure you're using thickened liquids when you go feed this client. And then also having the other person verbalize their understanding of what the task is, and then giving them the opportunity to ask questions, maybe just saying like, hey, what did you hear me say? And lastly, we have right supervision and evaluation. Just because you've delegated a task doesn't mean you've delegated responsibility. The nurse still has responsibility for the outcome. They have to follow up here. So we need to monitor, evaluate, and then intervene as needed, and then provide feedback after the task. So let's talk more in detail about the individual roles of people on the nursing team. First off, we have the registered nurse. Their scope of practice has a lot to do with assessments and then initiating care. For example, it's the registered nurse's responsibility to create and update the nursing care plan. It's also their responsibility to initiate the beginning teaching and then also to provide the initial discharge teaching. Clinical judgment comes into play a lot here. All the things we do here are based on our initial assessments and then ongoing reassessments as the patient's condition is pretty dynamic. Prioritizing client care is another big piece of the RN's role. You have to decide how you can use the people on your team to delegate tasks, what needs to get done first, and how to make that happen. Also, initiating any kind of blood product, giving a blood transfusion, there's a lot more risk here because they could have some kind of reaction. So this is more the registered nurse's job. Next up, we have the licensed practical nurse, the LPN. Their scope of practice is really similar to the registered nurse, but it's a bit more narrow. So let's talk through some things that are commonly delegated here. First off, medication administration. You have to consider that permissions vary often by facility, by the area you're working in. So you have to be cognizant of that. They are often administering routine medications and usually cannot perform an IV push medication. Other examples include a sterile procedure, a dressing change or suctioning, urinary catheterization, ostomy and wound care, ensuring tube patency, performing enteral feeding, auscultating, lung and bowel sounds. And then, of course, they still do the nursing roles of monitoring the RN's findings or reinforcing that teaching or contributing to the care plan, but they do that together with the RN. But just remember, the RN can still perform any of these tasks. That's the whole point of delegation, is that you still maintain responsibility and know how to do this, but you delegate it for efficiency. So say the LPN is busy giving a whole bunch of routine medications, the RN can still go perform a dressing change. The RN is unique in that we're all going on the same highway, but the RN has an all-access pass to all the lanes. Next up, we have the unlicensed assistive personnel, and we know this phrasing sounds a little odd. Let's just stick with UAP. When you're actually in practice, you're going to hear a lot of different words like probably a nurse tech, patient care tech. But let's stick with UAP. Talking about the UAP, they have one of the most unique roles because it really is so facility dependent. They don't have a license, so this means that they get trained in the tasks they're going to do when they get to the job. So let's talk about some specific examples of things they commonly do. First up, we have activities of daily living, maybe just helping the patient brush their hair or change their clothes. And then client hygiene, giving baths, helping with showers, changing bed linens. Also routine vital signs, again, for a stable client. Right after you hang a blood product, it's not going to be the UAP taking vital signs. Also emptying, measuring, and recording output. Notifying the RN of change in client status. This is a great opportunity to say to the UAP, hey, let me know if this happens in case you're concerned about something. Also skincare, maybe applying an ointment to help with incontinence, like a moisture barrier. This kind of goes hand in hand with hygiene. Also measuring a weight or abdominal girth, repositioning in bed, and then also commonly ambulating or walking in the hallways. UAPs often also transport specimens like blood or stool to the laboratory, other bodily fluids, and they may also be picking up blood products that you're going to administer. Let's talk a bit more about evaluation. This is one of those critical pieces of delegating. Like we said, the nurse is still accountable for anything that's delegated. We need to make sure these tasks are completed and check for accuracy and completion. We also need to give feedback, talk about the strengths and weaknesses, what could be improved, what are some opportunities to do better next time. Also providing feedback and giving positive reinforcement. Most likely these are the people you work with every day. It's so helpful to have positive relationships with your colleagues here. And then evaluating how quickly and effectively goals are completed. This plays in a lot to time management. There are some tasks that are a lot more time sensitive than others. Lastly, let's talk about time management. This is so important and underlies everything we do as a nurse. And effective delegation can really help make time management more efficient. Some of the important things include identifying tasks and activities for completion. You can make a list, pick out the things that are your highest priority and put stars by them. Set goals and time frames, and of course always remember to finish one task before proceeding to the next. And then consistently throughout the day you'll have to reprioritize tasks based on what's remaining, what comes up unexpectedly that you maybe didn't know. And then consistently throughout the day you'll have to reprioritize based on your remaining tasks and the things that pop up unexpectedly that you haven't planned for. And then another helpful piece is dividing tasks into smaller, more manageable parts. This is really where delegation can be helpful because you can delegate some of those smaller pieces.